If you ever develop new chest pressure, tightness, squeezing, or discomfort that lasts more than a few minutes, returns repeatedly, or occurs together with shortness of breath, nausea, sweating, dizziness, or pain spreading into the arm, jaw, neck, or back, seek emergency medical care immediately. When it comes to the heart, it's always safer to be evaluated than to assume it's nothing. And now, here's where things become even more surprising. The third warning sign doesn't always appear in the chest at all. Now, here's where things become even more surprising. The third warning sign doesn't always appear in the chest at all. Number three, pain that spreads to your jaw, neck, shoulder, back, or arm. Many people assume that heart-related pain stays directly over the heart. But the human body doesn't always work that way. The nerves carrying pain signals from the heart share pathways with nerves from other parts of the body. Because of this, your brain can sometimes become confused about exactly where the pain is coming from. Doctors call this referred pain. Imagine hearing a strange noise in your house. You think it's coming from the kitchen, but after looking around, you discover it was actually coming from the garage. The sound traveled in a way that fooled you. Pain can do something very similar. Someone may wake up with an aching jaw and think they slept in an awkward position. Another person may notice soreness in the left shoulder after gardening and blame sore muscles. Someone else may develop discomfort between the shoulder blades and assume it's simply poor posture. Yet in some cases, these seemingly unrelated aches are actually coming from the heart. The discomfort may feel dull. It may come and go. It may spread gradually instead of appearing all at once. And it isn't always limited to the left arm. Some people experience pain in the right arm, both shoulders, the neck, the upper back, or even the lower jaw. This is especially important for women who are more likely than men to experience these less typical warning signs before a heart attack. Of course, most shoulder pain, neck pain, or jaw pain has nothing to do with the heart. Muscle strain, arthritis, dental problems, and nerve conditions are all much more common causes. But if this discomfort appears together with unusual fatigue, chest pressure, shortness of breath, sweating, or nausea, or if it develops during physical activity and improves with rest, it deserves immediate medical attention. Your body doesn't always read the textbook. That's why listening to the overall pattern is often more important than focusing on one symptom by itself. Now let's move to another warning sign that many people mistake for simply getting older. Number four, shortness of breath. Have you ever climbed a staircase you've climbed hundreds of times before, only to reach the top feeling unusually winded? Or maybe you've noticed that walking to the mailbox suddenly leaves you breathing harder than it used to. It's easy to think, I'm just out of shape. I'm getting older. I probably need more exercise. Sometimes that's true, but sometimes your heart is quietly struggling. Think of your heart as the engine of your body. Every organ depends on that engine to keep oxygen-rich blood moving where it's needed. If the engine begins losing power because one or more arteries are becoming blocked, less oxygen reaches your muscles. Your lungs often try to compensate by making you breathe faster. That's why shortness of breath can sometimes appear before chest pain. Some people notice it only during exercise. Others experience it while doing simple household chores. Some even find themselves waking up at night feeling like they can't catch a full breath. This symptom deserves special attention if it's new. If you could comfortably walk around your neighborhood a month ago, but now you're stopping halfway to catch your breath, your body is telling you that something has changed. That doesn't automatically mean a heart attack is coming. Shortness of breath can also result from asthma, lung disease, anemia, infections, or several other medical conditions. But because heart disease is one of the leading causes of death worldwide, it's never wise to simply assume it's nothing. A healthcare professional can evaluate what's causing the change and determine whether your heart needs further testing. Here's another clue many people miss. Pay attention to how quickly you recover. If it takes much longer than usual to catch your breath after only mild activity, or if breathing becomes difficult while resting, don't wait to see if it goes away on its own. Getting checked early could make a tremendous difference. And the next warning sign surprises many people because it doesn't seem connected to the heart at all. It often begins in the stomach. Number five, nausea, indigestion, or an upset stomach. This is one of the most overlooked warning signs before a heart attack. Why? Because almost everyone has experienced heartburn or indigestion at some point. Maybe you ate too much at dinner, maybe it was spicy food, maybe you simply assume your stomach is acting up. But for some people, especially adults over 50, what feels like indigestion is actually the heart sending distress signals. Several people who later suffered a heart attack reported feeling unusually nauseated, bloated, or uncomfortably full hours or even days beforehand. Some described a burning sensation that felt almost identical to acid reflux. Others lost their appetite for no obvious reason. You might wonder, how can a heart problem make your stomach feel upset? The answer lies in the body's nervous system. The heart and digestive organs share some of the same nerve pathways. When the heart isn't receiving enough oxygen rich blood, those signals can sometimes be interpreted as discomfort coming from the stomach instead. It's another example of how the body doesn't always point directly to the real source of the problem. This is especially common in women and older adults who may experience fewer of the classic chest symptoms people expect. Of course, the vast majority of stomach aches are exactly that: stomach problems. Food poisoning, acid reflux, ulcers, viral infections, and certain medications are all common causes. But if nausea or indigestion suddenly appears alongside unusual fatigue, chest pressure, shortness of breath, dizziness, sweating, or pain in the jaw or arm, it's important not to ignore it. Your heart may be asking for attention in a language that's easy to misunderstand. Now, let's talk about a warning sign that often catches people completely by surprise. Number 6, cold sweats and unexplained dizziness. Imagine sitting quietly in your living room. The room isn't hot, you're not exercising, yet suddenly you break into a cold sweat. Your shirt feels damp, your forehead becomes clammy. At the same time, you feel lightheaded. Maybe the room seems to spin slightly. Maybe you need to sit down because you don't feel steady. Many people assume their blood sugar has dropped or that they simply stood up too quickly. Sometimes that's exactly what's happening, but when these symptoms occur together with other warning signs, they can also indicate that the heart is under serious stress. Here's why. When the heart struggles to pump enough blood, your blood pressure can begin to fall. Less blood reaches the brain. That's when dizziness, weakness, or even fainting can occur. At the same time, your body releases stress hormones like adrenaline. These hormones prepare your body for an emergency, often causing sudden sweating even when there's no heat or physical activity. Think of it like your home's smoke alarm. The alarm doesn't create the fire. It warns you that something dangerous may already be happening. A cold sweat without an obvious reason is your body's version of that alarm. Again, there are many harmless explanations for dizziness: dehydration, low blood sugar, inner ear problems, certain medications. But if dizziness appears suddenly along with chest discomfort, unusual fatigue, nausea, pain spreading into the jaw or arm, or shortness of breath, don't dismiss it. Those symptoms together deserve immediate medical attention. So far, we've talked about fatigue, chest pressure, pain that travels, shortness of breath, stomach discomfort, and sudden sweating or dizziness. But the final warning sign is perhaps the easiest of all to overlook because most people experience it while they're trying to sleep. And that's exactly what makes it so dangerous. And that's exactly what makes it so dangerous. Number 7, unusual sleep problems or waking up feeling that something isn't right. Many people never connect poor sleep with heart health. After all, who hasn't had a restless night? But some people who later experience a heart attack describe something very different. They remember waking up several times during the night for no clear reason. Some felt anxious without knowing why. Others noticed a strange pressure in the chest that disappeared after a few minutes. Some woke up short of breath, needing to sit upright to feel comfortable again. And others simply had a strong feeling that something wasn't right. It's difficult to explain, but when your heart is struggling to pump blood efficiently, your body may react in subtle ways while you're asleep. Fluid can build up in the lungs, making breathing more difficult. Your heart may have to work harder when you're lying flat. Stress hormones may increase as your body tries to compensate. The result can be interrupted sleep, frequent waking, or an unusual feeling of discomfort that you've never experienced before. This doesn't mean every bad night's sleep is a warning sign. Far from it. Stress, anxiety, sleep apnea, caffeine, medications, and many other conditions can affect sleep. But if restless nights are suddenly accompanied by chest pressure, unusual fatigue, shortness of breath, sweating, nausea, or pain that spreads into the jaw, neck, back, or arms, It's important to take those symptoms seriously. Your body often whispers before it screams. The challenge is learning to recognize those whispers while there's still time to act. Now let's bring everything together. The 7 warning signs we've discussed today are unusual fatigue that doesn't improve with rest, chest pressure, tightness, or discomfort, pain that spreads to the jaw, neck, shoulders, back, or arms, shortness of breath during everyday activities, nausea, indigestion, or unexplained stomach discomfort, cold sweats, or sudden dizziness, and unusual sleep disturbances or waking up feeling that something is wrong. Remember, none of these symptoms automatically means you're having a heart attack. Many other health conditions can cause similar problems. But when several of these signs appear together, especially if they're new, worsening, or different from your normal health, they should never be ignored. One of the biggest mistakes people make is waiting to see if the symptoms go away. They don't want to bother anyone. They worry they'll be embarrassed if it turns out to be nothing. But when it comes to your heart, it's always better to be cautious. If you experience chest pressure that lasts more than a few minutes, severe shortness of breath, pain spreading into the arm, jaw, neck, or back, or any combination of these symptoms, call your local emergency medical services immediately. Do not try to drive yourself if you're having severe symptoms. Getting medical care quickly can save heart muscle, reduce long-term damage, and may even save your life. Beyond recognizing warning signs, there are also practical steps that help protect your heart over the long term. Keep your blood pressure, blood sugar, and cholesterol under control. Stay physically active in ways that are safe for your body. Choose meals that include vegetables, fruits, whole grains, lean proteins, and healthy fats. Avoid smoking if you smoke. Take prescribed medications exactly as directed. And don't skip regular checkups, even when you feel well. Many heart problems develop quietly over time. Routine medical care often finds problems before they become emergencies. Your heart has worked for you every minute of every day since before you were born. It has never taken a vacation. It has never asked for a day off. The least we can do is pay attention when it asks for help. If today's video helped you better understand these warning signs, consider sharing it with someone you love, a family member, a friend, a neighbor. You never know whose life could be changed by recognizing these symptoms a little earlier. I'd also love to hear from you. How old are you, and have you ever experienced any of the warning signs we discussed today? Share your experience in the comments. Your story could encourage someone else to seek help before it's too late. Thank you for spending these moments with me and taking an important step toward protecting your health. Until next time, stay sharp. Why?